Hello, my name is Priya Chhikara. I'm a PGY5 in General Surgery at Mercy Catholic Medical Center. I'd like to thank you for the opportunity to present my abstract, which is affiliated with the Plastic and Reconstructive Surgery Department at Cooper MD Anderson, and is entitled Predictors of Infection in Mastectomy Flap Erythema Following Mastectomy with Immediate Tissue Expander Reconstruction. Postoperative erythema is a commonly encountered condition and can be attributed to many different etiologies ranging from infectious to purely inflammatory and non-infectious, which of course includes reactions to foreign materials frequently used in reconstructive procedures. The existing literature contains many reports regarding surgical site infections following tissue expander reconstruction. However, these studies are not sufficient in accounting for erythema due to infectious versus non-infectious inflammatory processes. In patients with a history of breast cancer who have gone mastectomy with immediate tissue expander reconstruction, postoperative erythema alone often cites concern for infection. This can lead to overtreatment with readmissions, a long-term IV antibiotic use, and reoperations with tissue expander removal, all without true evidence of infection. These infection control measures can create significant morbidity for the patient and have significant financial implications for the patient and healthcare system. With this study, we aim to define the criteria for assessing infection in patients who present with erythema following immediate tissue expander reconstruction by determining specific combinations of factors that differentiate erythema associated with infection from non-infection. Using the electronic medical record, we identified patients who had undergone mastectomy with immediate tissue expander reconstruction from January 2014 to December 2016. Of particular interest were the patients who developed erythema within the first 12 months postoperatively. Infection was further determined by positive cultures which were obtained from drainage or aspirate. We analyzed variables which were of primary interest, which correlated with the CDC's definition of surgical site infection in the presence of implants and included fever with a temperature greater than 38 degrees Celsius, elevated white blood counts, drainage or wound dehiscence, and localized pain. These primary variables of interest along with erythema were analyzed alone and in the combinations listed below for patients with and without proven infections. The correlation between these variables with the presence or absence of infection were then reported. We found that 38 patients presented with erythema. All 38 patients underwent further intervention with antibiotics, aspiration, or operation. 47% of these patients had culture-proven infection. Pain alone was present in 67% of patients with infection and 20% of patients without infection, and was significant statistically in predicting infection with an odds ratio of 8. Pain in combination with other factors was also statistically significant in predicting infection. Table 1 represents the variables with statistically significant predictive values for infection. Table 2 represents our data on the variables with statistically significant odds ratios for infection with erythema. In conclusion, while fever, elevated white blood count, and drainage and/or wound dehiscence were not found to be significant predictors of infection in patients presenting with postoperative erythema, these variables were more frequently observed in the infectious group versus the non-infectious group. Pain alone or in combination with other variables in erythema, as well as the combination of fever with an elevated white blood count, most reliably served as predictors of infection in breast cancer patients presenting with erythema following mastectomy with immediate tissue expander reconstruction. These combinations of factors, when observed along with erythema, may offer assistance in determining when further intervention is necessary in this patient population.